Good evening and welcome to another episode of inspirED. I'm Sarah Loudon from Total Health Conferencing, and tonight is a very unique and probably one of the most informative podcasts of its time for us. Look at COVID-19 experiences. So as a medical education company, we are used to talking about experiences of patients through the eyes of physicians and other healthcare providers. But tonight we have a unique and what I think is going to be really informative, eye-opening interview with patients who have experienced this global virus personally, individually, and we'll get from them a first-hand account of all the questions that I think, including myself, were asking. So rather than to take a lot of time going around and introducing everyone, I'm just going to ask each one of you as part of the answer to the first question to introduce yourself. Andy, I'm going to start with you. Andy, if you would tell us a little about yourself and tell us in terms of how you first knew that you were a COVID-19 positive patient.
Yeah, Andy Doolin, Charlotte, North here, 60-year-old, healthy, former triathlete back when I was younger, Ironman finisher, I've been a healthy lifestyle. My wife and I, we're in Charlotte, which is right next to South Carolina. My wife and I went down to the coast of South Carolina and had a wonderful 5-day trip down there. We came home to Charlotte on a Sunday, June it was the 10th when we got tested. So let's say June the 5th or 6th. I had a wonderful Monday, walked 18 holes of golf on Tuesday, carrying my bag in the June heat, had a normal Wednesday, woke up Thursday morning and said to my wife, I don't feel great. And she said, oh, hell, so let's go get tested. And so we went out to a drive-through testing center here, right near the house in Charlotte. And a day and a half, 2 days later, I came back positive and she came back negative. Although we can get into this later, she did have some symptoms, smell, taste, that sort of thing.
Thank you, Andy. And we will get into kind of the stages of how all of you experienced this illness. But Amanda, I'm going to go to you. Tell us a little bit about yourself, where you're from, and how you knew that you were COVID-19 positive.
My name's Amanda. I'm in Huntersville, North Carolina, and I fell ill the beginning of March, and I was sick for weeks before I was tested. I didn't know for sure I had COVID. I knew I wasn't feeling well. It wasn't really well known at the time about the smell and taste thing. I had gone to Atlanta like the end of February, like 28th, 29th, and March 1st, and I started feeling sick about 3 or 4 days later. And it was some days I would feel okay, other days I wouldn't. And then I tried to go to urgent care about a week later. Just told them, I was like, look, something's off. They told me it was allergies. I wasn't running a fever or anything. They had no desire to test me. So I went on for weeks sick. I lost my smell and taste. I could not get anybody to test me. And I finally, I saw a Snapchat ad actually that said new COVID symptoms, sudden loss of smell and taste. And when I saw that, that's when it hit me. I was like, I think I have COVID. and I called a different doctor altogether and finally got them to agree to test me. And that was, my first symptoms were March 4th, and I was tested on the 23rd, test results back on the 28th.
Wow.
Saying that I was positive, and that was the same day I ended up in the hospital. So.
Wow. Okay, well, we'll dive deeper into that. Chris, tell us a little bit about yourself, where you're from, and your positive COVID test.
You got it. So my name is Christopher Kreichman. I am a native third-generation New York City person, and I live in lovely Manhattan, 34th and 2nd, diagonally across the street from NYU Langone and Bellevue Hospital in the VA. just for some context, I'm an entrepreneur, or actually, correction, I'm a business developer and property developer, and I focus on public health. I'm actually on the board of CUNY Graduate School of Public Health particulars. I got sick while traveling as a CEO fundraiser as well, fundraising person around the country and dealing with other mayors and governors around the cities in the country. I was traveling. I also have an underlying health condition, and when I first noticed my symptoms, it was March 14th, and I was in Los Angeles after I got to Los Angeles on the 13th, and I was in San Francisco on the 12th before that, and I was in New York for the 9th, 10th, and 11th before that. I had an intravenous immunoglobulin therapy treatments for chronic illness that I have, which is CIDP. It's in the family of Parkinson's, MS, Lou Gehrig's, and ALS, which I bring that up because it's actually, I'm still dealing with problems now. I first noticed a sore throat on the 14th. My 40th birthday was on the 15th. And I immediately flew back and booked a flight and came home on the 16th when I thought that they were closing borders. I couldn't find a thermometer to get my temperature checked. And in Manhattan and New York City, you couldn't buy one anywhere whatsoever. So my nurses who I was in contact with thought that this was just a respiratory illness, and they said, well, you know, you live across the street from the emergency room over at NYU, your friend's the head of the emergency department for both the hospitals, like go walk in there and let them know your underlying conditions and get your temperature checked. So I walked over there on the 17th and I said, hey, like, I'm not feeling very well. I've been traveling, I've got these underlying issues, and they looked at my history like, you're not going anywhere, we're going to test you. They checked my temperature. I was 99.1 when I walked in. I was feeling sore throat. I was feeling tired and weak, but that could have been my underlying condition, so it was hard to figure out what it was. I had a little bit of a cough, but I didn't have any problem breathing. They x-rayed me. I was clear. They swabbed me, the nasopharynx swipe and the back of my throat. They did two different ways. And they said that I'll know in about 2 to 3 days whether I have COVID or not. And there is a hotline that will be contacting me. And I said, I understand. I said, I live across the street. I live by myself in an apartment, literally across the street. So if there's anything, I can always come back or whatever. They said, stay home, you know, got it. When I left, I was 100.2 or 3. My temperature was increasing since that hour and a half to 2 hours inside of the emergency room. I got home that night, started feeling not so good. Woke up the next morning to the phone ringing, and it was NYU's hotline calling me to tell me that I was positive, and thus brought me on a roller coaster of about a total of 15 to 18 days of the worst experience I've had, to the point where I had to go back to the hospital on the 20th, and they kept me there because they were worried about my conditions and my underlying issues, which is at that point they had stopped allowing me to have all my regular treatments for what became 7 weeks, which affected my neuromuscular disease.
Wow.
So I've been dealing with it significantly, and then I had to take a test every single week. And the pathogenesis of this virus was all over the map with me. There was a day where I was fine and felt like I was going to get better, and then the next day I had 104.3 fever and a truck hit me. I also, on the 17th at night, I coughed so hard sitting where I am right now at my kitchen table that I thought I cracked a rib, but it turns out that when I went in on the 20th, they checked. I tore my intercostals and my external obliques and abdominal. So even trying to go to the restroom, clear my throat, cough, sneeze, swallow, hurt like hell. So that's.
Yeah, and we'll get into, you know, kind of the manifestation of each person, you know, as you went through this, such a strange and unpredictable disease. But, you know, Chris, I'm really looking forward to hearing. And first, you know, before I go to Julie, I want to say, I know that there's residual effects in all of you, and, you know, you'll speak to that, but I'm so proud of all of you for being here. And I'm so grateful for you all being here, because for the vast majority of us watching and listening, myself included, I have to say that I consider myself lucky, but I'm also not alone in that I don't know anyone personally outside now of you all that have had COVID-19. And I think that is one of the disconnects mentally that people are having, saying, if this is such a big deal, if this disease is so debilitating for the people that get it and have severe cases, how come I don't know anybody? And then it's like this shift where you start doubting a lot of different things. And so having you here validates for people that all of the mitigating activities that they're doing to reduce the risk is worth it. And I'm so grateful for each one of you sharing your story. Julie, can you just tell us a little bit about yourself and then how you found out that you were COVID-19 positive?
I had a really different experience, as most people do. I've been an absolute vigilant about this from the very first time that I heard what was going on after doing research. And I, from the beginning of March till the end of April, left my home twice in an N95 mask with goggles, gloves, foot coverings. I mean, I took it to the extreme.
Yeah.
People weren't allowed to have shoes in the house, nothing. I was fine. I had only left the house twice, on March 19th and April 19th. And I also had 3 thermometers. Everybody had to check the temperature at night before bed, in the morning. I never in a million years thought that this could have happened to me. And then on April 29th, I had a bit of a stomach ache. And I thought, oh, well, that's weird. I must have a stomach bug, or maybe I have food poisoning. And I took my temperature and it was 99.7. I thought, well, it's not high, but that's odd, because I was 98.6 every single day, in the morning and at night, the entire time until I got COVID. So initially that day when I got the stomach ache, I thought I had a stomach bug, and my experience started gastrointestinal, diarrhea, vomiting, and that went on for about 3 days. After 3 days, I thought, well, this isn't normal. It's definitely not food poisoning. I have no fever, but I better go to urgent care. So I went to urgent care. They took my temperature. It was fine. I was in my whole mask again, my N95, all the precautions. And they actually, when they asked me what was wrong, pushed me out the door, pulled it closed and locked it behind me, and said, you have COVID. You need to either go to the hospital or go home and call Teladoc. And I thought, these people are nuts. I have a stomach bug. I don't have a single, respiratory symptom. I therefore did go home and call Teladoc, and after 2 days of speaking with them, they did diagnose me verbally as having COVID. I couldn't find any place that had a test. I found a place that said they may have them in Miami, which is a very long drive from West Palm Beach. And at that time, on Monday, I was very, very ill. I actually get a physical test until I ended up in the hospital 6 weeks later.
Wow.
And at that point, I was I had been trying to recover at home, and I had 8 Teladoc appointments, but then I developed shingles and they were afraid it could go to my brain. So I ended up being admitted to the hospital. I was on the COVID floor. My COVID test, actually, at that point, I'd had it for 6 weeks, came back negative, but my antibody test came back positive. So it was kind of an unusual set of circumstances for me. And like I said, at that point, I'd already had it for 6 weeks.
Yeah.
But I've had almost every symptom imaginable, and it's just been incredible, horrible experience.
Again, we're going through each one of your experiences, even up to diagnosis, and it's also different. And I don't know that in the months since we learned of this virus that there has been any type of national standardization in the way people are diagnosed, the way people are tested, the way people are kind of educated about those early symptoms. And it's another opportunity for us to kind of bring light to where there seems to be confusion, in that, all paths don't always lead to a clear answer. And Julie, you're a perfect example of what that looks like. Andy, I want to come back to you, because it sounds like you likely, or maybe I shouldn't say it sounds like, do you think that you likely picked up COVID when you were traveling? And was there any kind of communication with the doctor on why your wife was testing negative and that she might be a false negative, or was that not discussed?
We think Kathy was a false negative. We do think, now this is all guesswork on our part.
Yeah,
I think we picked it up in South Carolina at the coast.
yeah,
We had a couple visiting us that weekend from Charleston, which clearly is on the coast of South Carolina also, but they both came, they went home and came up positive as well. Both of them had similar experiences that we had. I'm so sorry that Julie was so sick. Amanda, you were big sick. Chris, sick. I wasn't super sick. I never had fever. I never had respiratory issues, but COVID knocked me down for those 14 days.
Andy, did it feel like, you know, some people have described it as like the worst flu they had. Did it feel like that, or like describe what it felt like that maybe you had context around, or nothing?
Yeah, it wasn't the worst flu I've even had. I was just tired.
Yeah.
Never nauseous. Again, Kathy came and checked my temperature every day, and once she lost her smell and taste, she knew that she had the symptoms as well.
Yeah.
And she was only down for about 2 or 3 days. False negative, we believe, for her. And I've got to admit, all of you ladies are stronger than us men.
I'm glad that's a learning point you took away, Andy.
Yeah, all of y'all are stronger than we are. And so what knocked me down for 14 days, she absorbed in 2 or 3. But we've been fortunate with that. And we went back to get tested on day 15, back to the same place we had gone to get tested before a drive-through, and they swabbed us. We're gonna swab us, but we waited in line, and the nice nurse, and bless their hearts, they're completely covered, standing in a parking lot. And she said, no, if you're feeling well and you don't have any symptoms, and today's 15, we're not testing healthy people anymore.
Yeah, I'm seeing Chris shake his head, and I'm gonna get to this because I do think that that's so much misinformation, because we know that cycle that people go on. But before I get to Chris, Amanda, you talked about this loss of taste and smell, and it is such a strange thing. In fact, my husband early on, probably, I'm going to say like end of March, my husband came to me and said, I can't taste, like the whole front of my mouth, I can't taste. And then the next day he said, I can't taste anything. Like even if I drink the Diet Coke or something, it just feels like something cold is going down. And I got to tell you, we live in South Florida. I called about probably no less than 8 hospitals in our area. No one would test him because he didn't have a fever. No one would test him. And here I was, Chris talked about having an underlying illness. I have an autoimmune disease as well. And I'm terrified at this point because I don't know, do I quarantine him? I've got a 17-year-old and a 6-year-old. Do I keep him away from the family? Do I send him to a hotel? Like, I'm in the dark. And, everyone was like, oh, it's probably allergies because you lose your taste with allergies. Girl, I'm 43 years old, and I never knew a single human being that lost their taste with allergies. So talk to us about, how do you get to the point where you're like, okay, I got to call a new doctor because I got to get this test and figure out what's going on. And then what happens from that point that kind of makes things turn worse?
Well, I wasn't, not that I didn't believe in COVID, I just wasn't like stressing about it. So when I started to feel sick, I'd already started coming down with something in January, and I like knocked it out. And then I felt the body aches coming on. I didn't think I had COVID. That was like because they made it sound like you definitely have fever. It's definitely like shortness of breath. I was like totally getting sick, and I would have a good day, bad body aches. Sometimes I would just lay in my my cubicle. My boss was like, what's wrong? I'm like, I don't know, my head weighs a lot. Like, you know, I just couldn't even hold my head up. And then the next day I'd be okay. And then I was like, maybe I'm knocking it out. And then when I finally got to urgent care, and he was like, it's allergies. And I was like, I wouldn't come to urgent care for allergies. I'm 34 years old. Like, I know what allergies are at this point. Look at my history. I don't come to the doctor very often. I'm here for a reason. And they were like, well, here, take this nose spray and this costs, and sent me on my way. And I honestly, I was so naive to COVID at that time. I actually thought they had tested me. I didn't even realize they had come to find out they only tested me for strep. Because again, I didn't think it was I had. I was like, and my boss, later they had a meeting at my company, and they're like, Amanda, you know, you haven't been feeling well. Do you know if they tested you for COVID? And I was like, I don't know, probably. And he said, could you call? And I called them, and they said, no, we only tested you for strep. It was negative. And I was like, okay. And my boss was like, well, ask if they'll test you. I said, can you guys? Nope, you don't have a fever. You don't know it's out of the country. We're not going to test you. And I was like, well, I got you on the phone. I think that nose spray you guys gave me is like burned my sinuses, because I can't taste my tacos, you know, and like that's a serious issue. And they were like, they kind of laughed at me. They're like, well, stop taking your nose spray. And I was like, well, have you ever heard of this happening? They're like, no, just stop taking it. And a week later, I still couldn't smell or taste, and I noticed it was affecting my appetite. And it was so funny because I was so upset about not being able to smell and taste. I didn't realize I was slowly developing this cough. I was sleeping in till like 3 and 4 in the afternoon on the weekends. I live alone with no kids, so it's like my dogs were letting me sleep in. So I had no idea. And I even, at one point, I even Googled it just to see, hey, loss of smell and taste. Nothing came up. And my coworker was like, I bet you it's that nose spray. So then I Google up class action lawsuits for Flonase. You know, I'm ready to go to town because I can't taste tacos, and I don't know if it's going to come back. You know, I was so upset about that I didn't realize I was coming on with COVID, and there was nothing, and then, so, you know, nothing out there at the time. And then it was on a Sunday night, and I was just scrolling, like, you know, the stories on Snapchat, and I was like, I tapped on it, and when it said, you know, new COVID symptoms, sudden loss of smell and taste, and I was like, oh my God. And I had posted on Facebook, has anybody experienced loss of smell and taste using Flonase, like a week before? And I was like, I got to go take that down. Everybody's going to know I have COVID. Like I went on Facebook and I deleted it. And then it, like the following days, I started talking about how all the NBA players had lost smell and taste. And then a couple people were like, hey, didn't you have a post? And they were sending me things, and I still didn't want to say anything. And then that's when I realized, I was like, I had to be smart, and I don't encourage people to do this, but I knew in my heart, I was like, at that point, I was like, I have COVID. But because I didn't have a fever, and, you know, the respiratory issues I wasn't really having yet, I called and I kind of fibbed a little bit. I told them all the answers they wanted to hear for me to get tested, you know, and that's how I was able to, okay, yes, here, we want you to get tested, go to this testing site. And then again, went through, and I don't regret, I'm not encouraging people to go lie to doctors, but at that time I was doing what I had to do to look out for me.
We say that so often for patients with cancer, especially women. You know, you find a lump and you go to the doctor and they say, oh, it's a swollen milk duct, or oh, it's your hormone. You know, you're probably at that time of the month and your breast has all this natural dense tissue. And we always say to patients, you're your best healthcare advocate. Like, you are the one that advocate for you stronger than anyone else. So you've got to demand certain things. So, you know, while I know what you're saying, that you don't advocate for anyone kind of lying to get things through, you knew what was wrong with your body and wanted to make sure that you were taking care of yourself. Chris, I'm going to go to you to just say, you know, your case had so many ups and downs, had so many twists and turns, and I know you have those underlying conditions. I'm not necessarily 100% sure that if you didn't have them, you wouldn't have had a similar crazy case. This COVID-19 looks so different. But, you know, talk to us about the first time where you were like, this is serious, and I need to be somewhere where I'm being monitored and watched.
Well, to answer that, I want to say something to preface this. I have 5 underlying health conditions. I'm on intravenous immunoglobulin 3 days a week, every other week, so I'm not in a wheelchair, and I'm this age. I I take Humira, I take a list of other things. Like there's a lot of things that compromise my immune system. And personally, I have lost one person I specifically know who's been near and dear to my family for 30 plus years to COVID. And I've lost about 28 people in my community, friends, fathers, grandparents, and siblings and husbands and children, all in my network here in New York. Obviously, Manhattan and New York City has been hit the hardest. Where I took it seriously was when I realized that the country and all leadership and everyone did not have a grasp on this. This was miscategorized from day one. My father's a doctor for 50 years. I was pre-med. My sister's a doctor. My other sister's a nurse over at NYU as well. My other cousin runs the nursing unit at NYU as well. So I obviously have a lot of knowledge and depth in my understanding, and obviously with public health departments and city council people. And when it was categorized as a respiratory disease, that was the mistake, because we've realized that there's so much more to it. Yes. And when I realized that, for me, this was a life or death conversation, was the fact that I've had ruptured a lung back in 2004, when all of my previous histories and things, like people joke with me that I have like 20 lives. I have more than a cat, because I've survived so many different things in my life, even a survivor of suicide when I was 22 years of age. So I've gone through a lot. And for me to be in this position, when the moment it was that it became deathly serious to me, was when I was home alone by myself and I couldn't clear my throat without feeling like someone was stabbing me in my side, that I realized I had to sleep on my side and prop myself in a position on an angle, so that just in case I woke up in the middle of the night, I wasn't gonna choke on fluid. Yeah. And that was the real moment. And I woke up on the 20th with 104.3 fever. And I didn't want to be a burden on the hospital system, because I felt that there were worse people. And I called the emergency hotline, and the woman said to me, listen, like, just walk over here if you can. Obviously use necessary precautions. I live in a 37-story building. It's got 300 units in it. I'm on the 32nd floor, so I need to get into a dedicated elevator. I've got to coordinate with building management so that I don't come in contact with people. Like, this is now a life or death thing, because I need to know what's going on. And when I was in the emergency room and came back in, when she said to me, you're better off being safe than sorry, because you're by yourself. There's no one there to check on you. God forbid something happens. Yeah. We're not trying to scare you, but you're better off coming in and getting checked out. So I came in, and they put me in a separate room and a separate entrance, because I was already positive. Now, again, this is back on March 20th. And they brought me in. And again, we're still deciding on shutting down things. So watching leadership, it's not a partisan conversation. It's just everyone is just not informed. It's a brand new disease. It's a brand new virus. We don't know. And for anyone to speak definitively, even today in July, is absurd. Yeah. So Chris, that's when I realized.
I want to get back to this part of, your story, especially when you're talking about, like, it's still so unknown. But before I do, Andy, I want to ask you, knowing that you've got to hop off, I want to ask you for your takeaway. I know your case feels very different than the rest of the team on the call, but what's your takeaway to people? If you could have said something to the pre-COVID-19 Andy or friends and family, what would that be that you can tell this audience?
Thank you. We were very safe. We were wearing masks at the Harris Teeter supermarket, at the Home Depot, anywhere in public. We've been socially distancing with our neighbors. And as some of y'all might know, we've enjoyed getting to spend more time in the front yard with our neighbors, apart, but getting to know everybody. It's been very nice. We have no problem with now in North Carolina, at least, and Amanda's in Huntersville, that's right up the street from us. We have no problem with the mask restrictions going in place. Is that safe? Yeah. As long as people wear the masks, stay socially distanced and be careful. Now, 3 of my 3 sons, all of them are in their mid-20s. And the boys aren't safe at all. That whole crowd. And so we've actually had situations where we've told one of our sons, don't come here, because he's hanging out with all of his buddies.
Yeah, yeah.
Get it to them that they have to take it serious.
You know, I think that again, for all the parents that are listening who have adult or, you know, older, like I have a 17-year-old, older kids, and even knowing, you know, your son saw that you and your wife went through this, but they didn't see you go through it like Amanda or Chris or Julie did.
No.
And it leaves,
Yeah, bless your hearts.
like, oh, big deal, you know, I'm not going to get that sick. But the reality is you don't know when you're going to encounter a Chris with 5 underlying autoimmune diseases.
Bless his heart, man.
You know,
That's horrible.
It's
You don't know.
a
No,
balance.
Chris, my heart out to you, my friend. And you too, Miss Amanda and Julie.
Yes, yes. Well, Andy, thank you for joining us. You know, we wish you and your family health and happiness, and we will definitely catch up with you as we continue on the series. Chris was, you know, talking about just the inconsistencies with everything, you know, all the things that he experienced, and we'll get deeper into his story and what it looked like in New York. I mean, as he's kind of going down the elevator, making sure he's not getting anybody else sick. But Julie, one part of your story that really resonated with me as we were kind of gathering together the bios for everybody is I don't want to use the word warnings because it's not warnings, but your call to action for people to understand this disease and to plan ahead with what you want the hospital to know if they encounter you unable to make your own decisions, what you want your family to know when we're going through this global pandemic where it's affecting different people differently. And decision making might not be in our ability when we get to the point where we're very sick. That resonated so much with me, and I want you to talk about your own thought process of getting to that point where you say, wait a second, I may be needing to make some decisions about, you know, ventilation, about end of life, about all these things that I was not thinking of until this happened.
And I unfortunately, Courtney, I did have to make some of those decisions, and I made them before I went into the hospital, because after 6 weeks, I had already been through what I thought was the worst of it. Like, I had had days where I was hallucinating, having nearly out-of-body experiences where the chills would be so bad that my hands and feet would be nearly frozen, even with a heating pad, and my teeth would be chattering so hard that I thought I was going to crack them. I mean, it was just so horrendous, and I knew what was happening, but I had no control. And there was times when I couldn't get out of bed for 3 days, where I would crawl to the bathroom. Like, I was trying to do everything to stay out of the hospital because I had done so much research, and I felt for myself that might be the end. But then it got to a point where these shingles were coming out so fast during my virtual appointment, the doctors could see them, and they said, you don't have a choice now, you have to go. So when I did go, I wrote letters before I left. I made decisions. I called a friend and put her in charge, because I knew that my family may not go with my own wishes, just because they would say, we don't care what you need to do. And that's not what I felt was going to be right for me. And what I saw and experienced in the hospital, of seeing people being, you know, hit with the crash cart, people were having strokes, people were just coughing and crying and couldn't speak and had no family, and they were taking them away and venting them. And just what I witnessed, I knew that I would either try to fight tooth and nail, but I would not be vented. And luckily, my oxygen never went so low that, you know, I was incoherent where they would have made that decision for me. And I had already presented everything when I arrived as to what my wishes were and who I wanted in charge and all of that. But it was a really, really tough experience. At one point, I had had these headaches that were so nauseating and so intense, and I had had conjunctivitis and pink eye in both my eyes, that I actually lost my eyesight completely for 4 or 5 hours in the hospital. And at that point, I thought, I can't even see. I'm in the complete blackness and at the mercy of the hospital and the nurses. And I thought, if I don't get my eyesight back, that alone is going to change my entire life. And luckily I did. I'm still having some problems. Like I had to have a brain scan yesterday. I had to have an injection where they tested the blood vessels in my brain. I've still got to see eye specialist. I can't drive at night. I'm still having some issues. But
And how long ago were you in the hospital, just so that we can understand the time frame?
I was only in the hospital for 5 days. I did have 2 bad relapses within 3 weeks of being home, where I nearly had to go back because I had 145 heart rate. And at one point my oxygen had dropped to 80 again. But luckily I was able to know how to control these things. The whole time before I went in the hospital, I had a friend who checked with a COVID nurse twice a day to go over all of my symptoms, where we were at in recovery, where I was at that day. I had had almost every drug known demand that they've been trying for this. The one thing that really helped me and that I asked for as soon as I got to the hospital was remdesivir, which they are finding is the most helpful of all the COVID drugs. But if you don't know how to ask for it, they're not going to automatically give it to you. It's very expensive. It's very on low shortage. But I had a vast knowledge going into the hospital as to what I wanted for myself and what I wanted my care to look like.
You know, the thing about your story that I think is the hardest to hear is how safe you were up to the diagnosis, how many precautions you had set up. You weren't living life carelessly. You weren't going out unnecessarily. You weren't exposing yourself. And then yet still this comes to you and comes to you so significantly. I have to say, it just, I mean, in so many ways, it reinforces that you cannot be too careful, that you really cannot.
And it's so hard. It's so incredibly random. I had signs for delivery drivers when Instacart came. They would ring the bell. I would wait for them to leave. I would go out and spray all the bags, wait for that to sit for 15 minutes and bring it in. I sprayed and washed every single grocery with gloves on and a mask. I was like a freak.
Right.
There's just no way of knowing. I mean, I did leave the house twice, but I didn't come down with it within 2 weeks of leaving the house.
Yeah.
So I have no way of knowing if maybe someone I came in contact with. I saw a couple friends who were working from home and went nowhere. You just don't know. It can,
Finds you. It has a way.
Absolutely no way for me to do contact or figure out how on earth I may have come down with it.
Well, Amanda, do you think you know where you picked this up?
Yeah, it was weird. My brother and his friend went to Atlanta with me. We went down for a Supercross race. My hometown's Atlanta. A lot of friends and family down there. It was just a Friday, Saturday, Sunday thing. Drove down Friday, came back Sunday. None of them got it. None of them got sick. I spent a good maybe week or two just trying to rack my brain, trying to figure out how I could have gotten it. I did go to, like a bar club Friday night. All my brother and all my friends were there as well. Like nobody got it. It's the weirdest thing. And I probably had at least, I used to work in the racing industry, so there's 30, 40 people there. Nobody came down with it. So, it could have been something as simple as like when I got out to get gas in South Carolina.
Yeah.
Yeah.
I
started stressing about it too much where I was like, I just got to let it go.
Yeah, you have to let it go. I just was curious if you kind of could pinpoint it. But so the next question I have for you is, because you fall into that younger category of people who either might, think of it, and I think you even said you were thinking of it like, oh, okay, it's here, I'm not sure that I'm going to be ultra scared of it. You went to this motocross thing. And what's a message that you would give the community of young people, let's say between 18 and 25, about COVID-19, your experience, and what you want them to know?
It's real and it's here, and I don't think it's going anywhere for a while. And there's no way for you to know. There's people getting it that were being super safe, and then there's, like I said, I didn't think it wasn't real. I believed in it, and I would defend it. Everyone's like, well, I don't even know anybody. I'm like, it's just here. It's fresh. Like it's coming, but I probably, looking back, I could have taken more steps to be safer. I didn't maybe necessarily need to have gone to the bars I guess it wasn't, reality hadn't hit yet. So that's why when I did become positive, I was like, I could do one or two things. I can try to keep this a secret and try to deal with it, or I can be very transparent about it and maybe help educate everybody around me in my life. And so maybe they do realize that it is real, or the people that were on the fence. And I obviously chose with being very open about it. And it's been a super, super long journey, and I don't regret it at all, being open about it. Have I taken some backlash? Yeah. Is there people that still won't hang out with me because of it? Yeah. But the good outweighs the bad. I get a lot of messages from people like, hey, thank you for coming forward and talking about it. I feel better that I had to put my business on hold. I feel better about making these decisions. It makes it a little bit more real now that I can say I do know somebody that has it. So I would just say, you're not invisible. And it's, for me, I was positive in March. I continued getting sick after I got out of the hospital. I tested positive again in April. At that point, I had been positive for 64 days. It got to the point where they didn't want to test me anymore in May. And I get that you can't chase a negative test, but for me, I started dealing with so many other side effects. I couldn't go see a specialist because no doctor wanted to see me because I didn't have a negative test on file, even though I was released. The COVID test site, my doctor ordered a test. COVID testing site said, no, we're not going to test you again. I know it's still new and we're still trying to figure out protocol and stuff like that. But from the state of North Carolina, I have these forums where people have been tested 11 times. They're allowed to get tested every 2 weeks. I got tested twice and it was refused the third time. And that was over a span of 3 months. I was only getting tested.
So when was your last test, and are you still facing that people won't test you?
My last test was April 22nd, and that one at that point they had got some of the higher up doctors here in North Carolina involved in my case, because again it was like I was in the hospital, and then when I was released I thought I was doing okay, and then I didn't want to tell everybody, but I was like, I'm starting to cough worse now than I was before I went in the hospital. And slowly, and I was like, you get scared because it's like you don't want to be a hypochondriac. And then in your mind, you have this vision of how this virus is supposed to be. It's only supposed to be like a 2-week thing. But looking back, I was sick for 3 weeks before I was ever even tested. and I hate to counter, but I'm still not doing too well. I finally thought I was going crazy. I was like, am I a hypochondriac? Am I thinking this up? Like, and I lost it because my work didn't understand why I was still feeling sick. I didn't understand. My doctor didn't understand, and that was the only reason why we decided to test again, because I was like, well, maybe this is a spinoff. Can we get tested again, see if I'm still positive, and if not, at least I'll have the negative test, and then we can go to the ear, nose, and throat doctor. And then they actually did my test and the results within 20 minutes because my doctor called ahead. They made it a big deal. I showed up, they were all waiting on me, and they made me sit in my car, and they said, oh, the results will be, we'll have it in 15-20 minutes. And when I looked up, I saw like 5 doctors walking out of the building, and I was like, okay, this isn't good. And they were like, yeah, you're still positive after 60 something days, but your oxygen levels are okay. And I was getting just the weirdest things. I was telling them how I felt like something was sitting on my throat.
Yeah.
And eventually they told me to go to the ER, and they write me up as a sore throat. I'm like, I wouldn't go to the emergency room for a sore throat. There's something weird going on. And now that I joined these other forums from people all over the world, they talk about it. And I'm like, see, I wasn't crazy. Everyone's like, did everybody get the sensation that they had like a tight hoodie around their throat? Like, yeah, me too. But they would do CT scans. They would see nothing. And it was like, you just felt like they looked at you sideways, like, are you just trying to take advantage of the fact that you had COVID? Are you trying to milk it as long as you can? I mean, here I am in July. I was just in the ER on Wednesday after I got the email from you guys because I felt off. I checked my oxygen levels and they would go down to like 70 something, and then they would go back up to 98, and then it was 70 something again. And I went in and same thing, they saw it and they just diagnosed me with pretty much asthma at this point. I can't go to the pulmonary because I don't have.
Did you have asthma before this or no? Now it's like this.
No, I never had any type of respiratory issue, period.
You think of this thing and like you said, you're thinking of it like we think of the traditional flu where maybe you're sick for 2 weeks. Worst case, you're sick for a month, but it's kind of this tapering thing after 2-3 weeks.
Yeah.
But the reality goes back to what Chris says. We don't know. We don't know. We still don't know. We don't know.
And we won't know for a while.
I was going to say, there's so many things, and people have politicized this so much. Like if there was a Democrat in office, we would know. Or because this person, it's like, this is science. This is something novel. We've never seen this before. It takes forever to discover the mechanism of action, like all the different things. And what I think Americans especially, and Chris, I'm going to get to you because I love that you've got this public health slant too, but Americans want things quick and tidy in a package that we can name it and we can put it on a shelf and we can say, that's not going to affect me because it affects old people or young people or Black people or people that travel or whatever. And that's not what this is. And because it doesn't fit in that box, it's almost like we are conditioning ourselves to just go, well, it's probably nothing. And, that's not the experience. And Chris, I want to kind of shift a little, your story is so amazing. I kind of want to shift because right now we're approaching the end of summer. Parents everywhere are having the fights with their local municipalities about sending kids back to school. Teachers are saying, no one's even asking me about whether or not I want to be going into a classroom. There are a million unanswered questions, like even if you figure it all out and you stage the kids and the teacher gets COVID-19, who's going to cover his or her class? How are you going to test all of those kids that came into contact? Is there going to be, medical coverage for their being out? Chris, talk to us about what you, as someone who's involved in public health and a survivor of this intense virus, wants to say about this being a public health disease. How do we reshape our thinking to think that way?
It's going to be a long-winded answer, just so you know. But I also want to preface this by saying I'm actually still dealing with the fallout. It took me 6 tests and 25 days to test negative for the insurance company and the pharmacy to allow me to go back on my treatments. And they just denied my treatments that I need. And I'm still fighting with them today, and it's July. Like I'm still fighting today on the phone, calling the insurance company, and they're like, you're not allowed to have more than 200 grams of immunoglobulin per month. And I need 360 grams per month. They're like, no, the textbook says you can't have that. So I'm like, but I've been on 300 grams a month for 2 years. And now, so the problem with the insurance company, and this ties back to your answer, and your specific question about a public health issue. We're not realizing that underneath all of our systems, it's corrupt and it's got problems systemically all over the place. You got to understand that insurance companies are paying out here in New York State like 23 to 25,000 per coronavirus case to hospitals and other assisted living homes for elderly. That is affecting their bottom line.
Yeah.
Now, when it affects their bottom line, they look at people like me and the path of all the people that have other utilizing the resources of the health care and health insurance system. And they start going, oh, well, you know what? You don't need that much. You don't need that much. You don't need that much, because they're trying to keep themselves in profit positions with their shareholders. If you ask my honest opinion and what I'm working on holistically as a CEO and developer, looking at what the cities are going to look like and the world in 100 years from now, because we don't have what we were promised for 2020. We don't have the systems, we don't have the cities, we don't have the healthcare, we don't have any of the stuff that we expected we were going to have. So when it goes back to going back to school, it's first off built from the Industrial Revolution. And the way the education system in America works is to create people who are employees. It's designed to be widgets. And we're now knowing, we've been facing for the past several years that 65% of our economy can be automated in a turn of a switch.
Well,
and they've been delaying that.
We proved it. We proved it when everybody,
Yeah,
when everybody
absolutely.
had home. Yeah.
And I refer to, looking at the economy, looking at the stock market, looking at everything that's going on, infrastructure. And I do have empathy for the people who build companies because that's all I've ever done. I've only worked for other people 6 months my collective entire life. So I understand what it's like to have poured your heart, soul, and potentially generations into building a company. But this isn't a matter of politic. And to go back to the whole politic part of this, Winston Churchill said, don't let any crisis go unused. Yeah. And so you've got everybody manipulating the system. But the reality is that we have to respect that we live in a planet that's not 1918. There was 1.6 billion people back then. And now there's almost 8 billion people on the planet. The population density alone. People were mad about the fact that the numbers weren't accurate based on the statistics and the projections. And they're like, they were wrong. No, they weren't wrong. Yeah. Those were worst case scenarios to scare you to stay home because that's what we needed you to do. And you stayed home. And so we flattened the curve as much as we could here in New York. And we suffered 28,000 people die or more. And people argue the number in New York City and all around the country. And you know what? When it comes to the numbers, folks, you want to send your kids back to school. You want to, there's a lot of ideology and a lot of belief that the numbers are inaccurate and they're lower. There's belief that masks don't work and the efficiency of face coverings. Plain and simple, folks. If it works 1%, do it. Yes. Because it's not about you at the end of the day. It's about the person who looks like me. I'm a former professional bodybuilder. I'm 30 years in the fitness and wellness industry by lifestyle. And I still get rocked by health conditions. And if you choose not to wear a mask because you're okay, then fine. You shouldn't live in New York City. You should go to lesser dense areas. You should be more self-aware. If you want your kids to go to school, look, we have an antiquated system. We have to think about better. We can't build a better system, actually. It's actually, this is the perfect time where the entire planet got shut down. This is the first time that we're facing in 100 years an opportunity to say, let's build best. Yes. We have 244 years of knowledge in this country, in this experiment of the United States of America. And we know that we've got issues. We know that there are racial tensions. We know that there is corruption. We know that there is inequalities. We know that there is issues. Like, you can't deny it at this point anymore. We know that there are these things. It's time to, instead of reform, it's time for new. We have to start looking at things as what's the best way to move forward at this point, as opposed to the tried and true way. So I understand that people are at home and you're with your kids, you're trying to run a job, or you're trying to take care of everybody in your close proximities. This is actually a blessing in disguise. Think about this. It's been 100 years since we've been all forced to stay at home. Yeah. Like, think about the beautiful generation that's going to come out of this because of the attention. Yes, there's going to be some domestic violence. There's going to be divorces. There's going to be problems. There's going to be issues. But we also still don't know the ramifications of what this virus can do to me and to you, Julie. We don't know. And how about the other people that look like they're fine as well? Like, we don't know. There's too many unknowns. And in my opinion, the best thing to do, and I wish we had done this back on March 1, if in March 1 we decided to shut down, and I mean literally shut down, because we've not been locked down. People like to throw around the word, we've been locked down. This isn't a lockdown. What I experienced during the rioting, the looting, and separately the protesting here in New York City with a 6-day curfew, that was a lockdown.
Yeah.
I didn't see any of that during all the deaths and all the things that we dealt with here in New York City. I saw the trailers at NYU, the 16 tractor trailers of morgue trucks. I have photos, I have pictures, I have videos. I shared them with my friends in the West Coast and around the world. If you look at my Facebook or my Instagram channel, you could see I documented everything to show, no, this is real. And to think that we can go through this for 6 months and then go back to normal is arrogant.
Yeah.
It's not right. And I don't think it's right to put you as a teacher in that position. I don't believe that we can't have education. I think that we were not prepared for online learning. And now is the time where we should actually, instead of putting it off, we should be focusing on that research. I mean, Superstorm Sandy happened here in 2012 in New York City. And I was walking with my friend earlier, who's an architect designer, and with a huge history of capability and expertise. And I said, you know, it's really interesting. Do you see any flood bills? Zero. Because it's not a problem, we don't do anything. Like, we've had the past several months, we haven't built more hospitals. In a nation of 360 million people, between registered citizens, visas, traveling, and undocumented people, we have about 360 million plus people in this country. Yet we only have 950,000 hospital beds.
Yeah.
Like, why aren't we building more hospital beds? Why are we not doing this stuff?
Yeah.
Like, it's time to think on a best case scenario, and we need to actually take advantage of this time. If back in March 1st, we decided for 8 weeks to shut everything down, freeze mortgages, freeze the stock market, freeze everything, and just say, you know what, folks, we're going to figure out how to subsidize so that you can handle the next 2 months. We're going to close state to state transportation, because a lot of the other states that are dealing with this, I got news for you. Here in New York City, we're 60% less at capacity. People have left and gone home. Where do you think home is? Texas, Iowa, Wisconsin.
Florida.
I watched a person on Florida, absolutely. We had a lot of New Yorkers go down to Florida, and now those New Yorkers want to come back to that are down in Florida want to come back to New York, and we're like, hey, stay where you are.
Yeah.
Like,
Yeah.
we don't need that.
So much that you're saying, I think you can't argue with it. I mean, it's hard for me to see people talking about, you know, their First Amendment right to not wear a mask and my body, my choice and all. It's so hard for me to see that, because I think about the people who, like myself, have built businesses and who have had to make significant sacrifices for the greater good for other people without complaint, to this moment without complaint. And I would do it again. And I know that people who have lost their businesses would do it again, knowing that we did something to affect change so that more people like the three of you wouldn't be going through what you all went through. Julie, when, you know, I'm listening to Chris, and when I'm thinking about him talking about things on a big scale, and then kind of correlating it back to someone like you who did take all the precautions and was very informed and continued to be informed from a healthcare perspective, what do you wish people know? Not what do you wish people knew, but in this moment, since you have a platform, like, what do you wish people know about this, and how would you like them to take that information to change behavior?
The only thing that I can stress, which I do all the time, because there are so many naysayers, even on my page, I've been a very proponent of explaining how this all occurred, and I've been upfront from day one, and I've, you know, joined support groups, and I've been there and given a lot of advice and a lot of help to people, and I don't delete or get rid of people that go against what I may have to say, because it's certainly my opinion from my experience. But I find it very, very troubling that each person will just not look out for the other. Yeah. You know, when they're refusing to wear a mask, and to a point of being aggressive about it, you know, and insisting that's not what I'm going to do. I mean, you have people in Florida that are making fake medical excuse cards so they can show them and go around places with it unmasked. it's not just about you yourself not wanting it. I don't like them. They're uncomfortable. I have done everything from March 1st that I could possibly do to protect myself and others, and I still got it. They need to be aware that it's not just about one person. It's like Chris said, it's about everyone. If you can avoid by not infecting one person, if you maybe have asymptomatic, then you're avoiding that person not affecting another person. It's no harm to just wear it in a public place. If you're outdoors, exercise, if you're not around others. But when you're exposed to other people, if you're not willing to do it, then just don't go. Just have courage, respect, and know that by doing that, you could be not harming someone when your mentality should be wanting to protect someone. It's not about one person. It's about the entire world.
And it's so, you know, as you're saying that,
and people are not precautious.
as you're saying that, I'm thinking, you know, even though we may all know those people who say like, no way, I'm not going to wear a mask. You know, here's evidence that masks don't work. Sometimes I want to say it's not even about the mask. It's just about the action. It's just about do it. Like, it's not about whether you believe that it's preventative or not preventative, or, you know, you're saying that other people are sheep to do it. Just do it. Do it because you're a human being. And I know that you're not a person who would ever say, I knowingly or unknowingly would like to hurt someone else. So at the end of the day, when there are real people like the three of you who have experienced something that has fundamentally shifted your life for the rest of your life, to know that something I do as an individual could prevent that, or at least reduce the risk of that happening to someone who I love or someone who I don't even know, as just a human being, it's like, don't let it become about the argument. Let it become about the action. Do it because you're kind and you're loving and you're good. Stop playing into like the narrative around it. And I think that that's something that we all have to learn as a culture. And we all really have to say, you know, someone said this to me and I thought it was the best analogy. They said, well, only a certain, you know, if you get a whole bunch of people together, only a certain number of them are going to get sick, and then only a smaller number of them are going to die. And the person said, so it's effectively, to that argument, it's effectively saying, I'm going to give you a bowl of blue and red M&Ms, and it's a full to the brim bowl. In it, there's going to be 10 M&Ms that make you go to the bathroom for 3 days straight. But there's also 5 of them that are going to kill you. Go ahead and have the M&Ms. Like, if you're really, I mean, take all the nonsense narrative away. If someone gave you that literal bowl, I can say, I would not take one M&M out of that bowl. It's not worth the risk. So wear the mask, stay at home, wash your hands, do all of these things, because at the end of the day, I don't want to go to the hospital. Julie, I don't want to be making decisions about, will I let a hospital put me on a vent? I don't want to be making end-of-life decisions. Amanda, I don't want to be saying to my 17-year-old, you could have prevented this if you listened. Like, I want to have the fullest and best life, and I want that for other people too. And the three of you inspire the listeners to look at it from that perspective, because you are all very real people. You're not here making up stories. You're not here telling of things, exaggerating of things that have happened. All three of you have coughed, sneezed, had trouble breathing during this interview. And I've watched it and I've thought to myself, Lord, just be with them, because this is something that's going to affect them for a very long time. So it just, you've got to turn it on its head. And hearing Chris, you, and hearing Julie, you, and even Amanda, you know, as a younger person, I know how you must have felt struggling between, do I live out loud with this and face that people may be scared to kind of come around me again or not really understand if their risk, or live out loud and say, guys, don't let this happen to you. Be safe, be smart, be conscientious, be kind. that takes so much in this new culture for young people. That takes so much, and I'm so proud of you. I know Chris and Julie stand with me to say we're so proud of you for the decisions that you've made surrounding this and becoming an advocate for other young people so that they don't have to experience what you've experienced. It's really, really something for all three of you. Well, we're rounding to the end of the interview, and I want maybe each one of you to give a sentence or two about, ultimately, if you were sitting in a bus with someone and there was only one thing you could say to them about this, where we are, you know, what we're going through and how we come out of it, what would it be? Chris, I'm going to start with you.
Thank you. I'm going to say two things to that person. Number one, we need more empathy in this world, especially now. And that's because we live in a society that rewards sociopaths and narcissistic behavior. And the only way to overcome that, to empathize with someone else because you don't know what you don't know, is empathy. Look up the definition and understand what it actually is. It's not sympathy, it's empathy. It's a different word. And the second thing I would say to them when it comes to where you stand on whether to wear masks or not, a First Amendment right, we all have rights, but your rights end in a society, in a social contract of this conversation where my rights begin.
I love that. So powerful. Thank you, Chris. Julie, I'm going to go to you.
You know, Brittany, I'm really following along with what Chris is having to say. My guidance would be to have kindness, to have caring, not just for yourself, but for the persons you're sitting next to. You don't know where they've been. You don't know what they've gone through. You don't know who they've lost. You know, put all your opinions aside. Put your politics aside. Do what seems kind and fair and courteous and respectful. Go back to thinking about your neighbor. You know, I found out about this. I told people the supplies they should get on hand, not for themselves. In case they got sick, they would have them. But what if their neighbor got sick and couldn't go out of the house? What if their neighbor couldn't leave? I gave people lists, pictures, you know, where they could get these things, what could help people who are alone or who are quarantined at home and who are sick, and what they need to be able to survive and try to improve their health. Get these things, have them for anyone who needs them. Don't just have them for yourself. We all have to work together. There needs to be more support. There needs to be more community. And all it feels like all the time is that it's getting divisive. I've had people tell me, stop promoting fear, stop exaggerating your symptoms. I'm not exaggerating anything. If you don't want to take what I say to heart, don't follow me, don't listen to me, but don't tell me I'm exaggerating. I am warning people how bad this could be. And they could lose friends, family members. Oh, but as long as it's not me. This is not a situation where people need to be thinking about themselves. They need to be thinking together for everyone, not just in this country, but the world over, or this is never going to leave.
Yes, you're right. Julie, you know, kindness does matter, and something fundamentally shifted, you know, going back to what Chris said, something fundamentally shifted in the society, especially on social platforms where the screen and the typewriter allows us to say the most vile things to each other that face to face. You know, I've known you for this interview. I never could look at you in the eyes and say, Julie, stop exaggerating your symptoms. But before, in front of a screen, I can type whatever I want. And it's like we've got to have a restoration of kindness. It's going away somewhere. It's like we've got to get it back, because once that goes, there's not much more as a society that holds us together. So I thank you for that message. Amanda, I'm gonna end with you on what you would say to someone about the experience, where we are and where we're going.
Follows along with Chris and Julie. It's one thing I think that people don't even really think about is I'm absolutely terrified of the people, that are calling people sheep for wearing masks, and they make you feel so uncomfortable. Like I still haven't gathered up the courage to go to a grocery store yet. I don't want to run into somebody who feels that they need to tell me, what I should do with wearing a mask. They don't know. You don't know what I just went through hell for 3 months. I was released off isolation and I still stayed an entire another month of May because just to be extra safe. And then I finally get the courage to go out, and I'm terrified to cough, around someone. I'm terrified that I'm going to get made fun of for wearing a mask, that they don't know what I just went through. My first time I drove to a CVS, I was still under isolation, but I was allowed to leave to go to the pharmacy to get more meds. And I took advantage of it. I was down, and I was really just trying to take in the air. And I remember this mom and daughter walked by in front of me. The line was backed up, and she was like, "Mom, why did she get to wear a mask?" And the mom was like, "Because some people like to be dramatic." It was like in the car, and I was like, I literally had just got out of the hospital like 2-3 days beforehand. I was like, I've got the Rona. Like, I'm not being dramatic. And prior to Corona, I've got friends who've got family members with Lyme's disease, or they could be doing chemo, whatever. They would wear a mask. You don't know. And it's not our business why they're wearing a mask. It doesn't matter. What do you make fun of people for wearing seatbelts too? Like, if that's
wheelchair, right.
Don't bully people. You don't know what they're going through at all. Like I still like, I literally, if I feel I'm going to have a coughing attack, which hopefully now the asthma meds help, but I'm like, I will literally almost hold my breath and try not to breathe and try to hurry up and get away from somewhere. I want to deal with the backlash of people looking at me sideways, or, oh, you got the Rona or whatever. And it's just like, I don't have to explain myself to anybody. And I do kind of joke about it, but it's, people are so cruel nowadays, and like they lack empathy. But who am I to judge? Like, I would never feel that it was appropriate to tell somebody to wear a seatbelt or not wear a seatbelt, or to wear a mask or no, or like, so don't do it to them. It's nicer if you join on, but don't be, trying to take your anger out on people and calling them sheeps. Like, you don't know what health issues they have going on. I'm still, it's July now, and I've been sick since March. I'm still dealing with issues. Like, last thing I need is somebody bullying me for me just trying my best to go back to a normal life.
Yeah, and that word, you're using that word, like, I'm saying to myself, what an appropriate word, because it really is bullying. It's someone using their position of ignorance to press someone else down. And that's exactly what it is. And again, dovetails with, what Chris and Julie said, which is we've got to be kind. We've got to be considerate towards each other. And ultimately we have to get through this together. We don't have a choice but to get through this together. And it really is going to be left to see, who gets through it and what stories we will tell on the other side of it about how certain people and how certain groups fared through this. And it's, it's sad because you don't have to learn the hard way. But as we're now to the end of the call, I can't thank you all enough. You've opened my eyes to so many things. I really do pray that each one of you have full restoration of your health in every way. I pray that because not just for your own health, but I pray that because I know that each one of you have a story to tell and a voice that needs to be heard. And it's going to take continued courage and continued stamina, especially as those other voices rail up louder. You have to have just as much resilience to be able to say, no, let me tell you the truth. And so we stand behind you with telling that truth. We thank you so much for sharing your experiences and your stories and your wisdom here with us. And we certainly, and probably more than ever, have I ever said this with more conviction, I certainly have a time where all of us can get together in person because, this has been something that shifted us so much. But I appreciate your courage and I appreciate you being here. And I look forward to a time where we are having more productive conversations about being our best, like Chris says. So thank you so much for your time and good night.